Hello, I'm Dr. Alexander Daynard here at Steinway Family Dental Center, and we get a lot of questions about dental crowns. So today we're going to discuss some of those questions that you sent to us here at Steinway Family Dental Center. The first question we got is, what are dental crowns? Well, the crowns are basically like helmets for your teeth. Well, first of all, teeth is the only bone that we have outside of the body, right? So it's the only bone that is exposed to us chewing. And it's bone on bone when we're actually chewing food, right? So the teeth go through a lot. And when they get damaged because of misuse, right? Or they just not cleaned properly, and we get some more decay in there. So, or we have old fillings, old restorations that no longer fitting you. So if it's detrimental for you to get larger filling because it can break the tooth, then we would get a dental crown. Crown is basically like a helmet for that tooth that helps them withstand all the forces of chewing food. The next question is, what are the alternatives to dental crown? Well, if doctor recommended the crown already, then that is probably your best alternative. Sometimes before you get the crown, you can get an inlay or onlay, which would replace part of the tooth, but not the entire tooth. You can also be recommended to get a veneer if it's in the front of your mouth, like on front teeth. But crown is recommended in case when there is full coverage necessary. And that is probably your best alternative to keep your tooth. The next question is, what type of dental crowns are there? Well, they are anterior or posterior. In other words, whether the crown is positioned in the front, on your front tooth, or in the back tooth. The other difference could be, or possible, is the different materials that is used to fabricate the crown. The crown could come off, and most of you are familiar with that. When you were very little, there was crowns that made out of only metal. Those crowns are very thin, and because they're made for baby teeth or deciduous teeth, they would come out with those baby teeth, right? So then we're not planning to keep them for very long. That's why metal crowns are okay. The other type of crowns that we have is porcelain fused to metal. And for many years, I would say over 100 years, that used to be a gold standard in the dentistry. However, now we have something better than that. We get crowns that are made out of synthetic diamond called zirconia. And those are probably the strongest crown available on the market today. There are some porcelain crowns that are also available, but the strongest one by all, it's still zirconia. The next question is, what are the advantages and disadvantages of different types of crowns that are possible? Well, different materials have different implications. Like, for example, there are IMAX crowns that are very, very cosmetically pleasing crowns. So those usually used in the front. However, they're not as strong as zirconia crowns that would be used in the back. Lately, there's a newer generation of zirconia crowns that also could be used in the front, and they look quite good. So a lot of times you can't even tell that those are the crowns. That's how good the zirconia crowns got. So in my opinion, those are the best. The next question we got is the dental crown necessary after the root canal treatment? And the answer is yes. It is a standard of care or gold standard in dentistry after you get tooth root canal, because the tooth is dead and it does not receive any nourishments from the body any longer. Therefore, it's like a dead tree, right? It's not as flexible anymore. It's a little bit more stiff. And if we put a crown on it, it will last a lot longer. Also, if you get a small damage on the root canal tooth, like a cavity or something, unless the dentist checks it for you, you would not know it, because if the tooth was alive, you may get some pain from it, and that would bring you to the dentist to check and fix. Since the root canal tooth does not have a nerve inside anymore, it's like an unplugged lamp, which you cannot get electrocuted anymore, right? Because it's unplugged. Therefore, the nerve of the tooth will never tell your brain that something is going wrong, and then you would get the tooth broken. So the crown is actually a very good solution for all of those problems, because it will eliminate it, and the tooth will last you a long time. The next question is, can you explain the dental crown procedure? Well, the dentist will remove old fillings and all the decay from the tooth after he gets you numb, of course, because you don't want to feel any of that. And then you would make a geometrical form of the crown, something that could receive a crown on it. And then you would get either scanned or you would get impression for the permanent crown. And then the dentist would most likely put a temporary crown on it. Or if it's done on the same day, then you will just wait until the crown is fabricated and then you would put the crown. The next question is that does the dental crown placement hurt? And the answer is absolutely not, that you don't even need injection for the placement of the crown, which is done on the second visit of the crown preparation. So you don't need injection for that, and no, it does not hurt. Getting the first visit when you're starting the crown, yes, you would require dental anesthetic, and you don't have to be put to sleep for that. It's just a local anesthetic, and you can have the tooth prepared for the crown. The next question is there any consequences for getting a dental crown? Well, you should treat it like your own teeth, and of course, you should understand that it does need to be brushed, even though it's not possible for you to get cavity through the crown like you can through your all natural tooth. But you still need to get it clean. The next question is it worth putting children's teeth in crowns? Well, if the child has a lot of damage in on the tooth, then yes, it would be worth it for you to have the tooth protected with the crown. The next question is, do crowns look like normal teeth? And I can tell that a lot of times they look better than normal teeth. Next question, can you get cavities on crown teeth? Well, you can't get it on the crown. The crown materials are not alive, so you cannot get it decay. However, your teeth can still be decayed underneath the crown, right? So you still need to have them brushed, flossed, and seek hygienist regularly. The next question, how should I take care of my dental crown? Well, the same as I said before. You should brush and floss your teeth, the same thing with your crowns, and seek hygienist regularly. The next question is, how long can you expect your dental crown to last? Well, we do get patients who don't take care of their teeth and the crowns fail pretty fast. But we also get people who cut their crowns down and it's been 20, 30, 40 years and they don't need the replacement on it. So the newer crowns should last even longer than that. The next question is, does insurance cover dental crowns? Well, most insurance companies classify dental crowns as major procedure. It gives them opportunity to share costs with the insured, which is with the patient, right? So they would cover 50% of proposed fee that they would cover. In other words, if let's say the fee is $10, of course I'm making the numbers out. If the fee is $10 to make the crown, the insurance may say that we only cover anything up to $6 and we pay 50% of that. So they give you $3 and you're supposed to pay the rest. The next question is, how can I schedule an appointment for dental crown? And you should give us a call here at Steinway Family Dental Center. It's 718-728-3314. Speak with one of our scheduling coordinators, or you can request your appointment online. Go on alldentalneeds.com and request an appointment, and somebody will contact you. I hope we've been able to shine some light on the questions that you had about dental crowns. And if you still have some further questions and they're more specific that we did not answer today, I will encourage you to give us a call and come in and we can discuss it in person. Have a good day.